Welcome back to Alabama News Network this morning. It's Wednesday, so that means we're being joined by Dr. Kathy Lindsey. If you have a health question for her, you can call us 1-800-504-4084 or 420-TALK. Dr. Lindsey, thank you so much, as always, for being here. We appreciate it. Talking about something that's a little bit uncomfortable, but it's colorectal cancer. Yeah. Quickly tell me about that, and we have a caller on the line.
Okay, great. Well, it's very common. It's the third most leading cause of cancer in the United States. 1 in 20 people will get it. Most people are over 50, and 90% of it can be preventable if you get the proper screening. And
it is something that you wouldn't think it is, but it's like you said, the third most leading.
Yes. It's very common. 130,000 new cases this year will develop.
That's amazing. All right, we have a question. Okay. You're on with Dr. Lindsey. Do you have a healthcare question?
Yes. My name is Clifford and I'm having spine crushes, and when I begin to move, it cramps.
Say it again. What do you have? What's the problem?
Every time I move, my spine hurts, and when I move even more, it starts to cramp.
Okay. Every time he moves, his spine hurts.
Okay. Well, when you have pain like that, it could be anything from just a strain in your muscle. If you've done something that has been strenuous, it could be inflammation inside an organ. Depending on which side it is, if you're running a fever or chill. So if it's mild and you know you've strained a muscle, you can take a mild anti-inflammatory. If it's something more prominent, you probably need to see a physician just to let them check a urine, some routine lab work, and do an exam.
Now, prevention for colorectal cancer, coming back to that.
Right.
Colonoscopy?
Right. That's the #1 most accurate technique. It's a visual technique. There's some other preventions. Most people with an average wrist start at age 50. And there's other things that can be done, but that's the #1 leading preventable thing. 90% of colorectal cancers can be prevented if you do the colonoscopy.
And I think the biggest thing about getting a colonoscopy is people are scared to do it. It's obviously uncomfortable. It's not something you want to go through. Kind of talk about the process there and what you undergo.
Well, the most thing people dread the most is the prep. You have to drink the liquid to get a clean colon so they can actually see any polyp that might be there. And most of them are visualized and removed and biopsied so that you know if you have an increased risk of colon cancer. Then they give you a little IV sedation for the prep that day, and most people tolerate it very well. They wake up pretty refreshed afterwards. You just need a driver. So it's worth going. Try not to avoid it. We still have a lot of non-compliance with it, but 25% decreased colon cancers from 2010 to now because people are getting their screenings.
Good to find it earlier. All right, we have another caller. You have a health question for Dr. Lindsey?
Yes, I do. I had a partial hysterectomy, and every time I go to the doctor, they say that I no longer need to have pap smears. And I just was concerned about that. I have a family history of cancer, which is breast cancer and other types. But I was just wondering, is there really not a need for me to have a pap smear or any kind of testing? And also I wonder about ovarian cancer. How can that be detected?
Okay.
Good question.
Yes. Partial hysterectomies are very common. That means they take the uterus out and leave the ovaries. And pap smears only screen for cervical cancer. And most of the time the cervix is removed when you have a partial hysterectomy, so you want to make sure that's the case. But if you've had the partial hysterectomy just for mild problems, the pathology on that was benign, meaning that you didn't have any type of cervical or uterine cancer, you do not need a pap smear because it would screen for cervical cancer. Ovarian cancer is not screened by pap smears. The physician can feel the ovaries at the time of the exam, but still that can miss ovarian cancer. There's not a very good way of screening for that. There are ultrasounds that we can check to see if there's any abnormalities, but a lot of it goes on symptoms. And if someone's having weird abdominal symptoms, a change in bowel habits, bloating, speak with a physician. And family history of ovarian and breast cancers can be detected in you if you have a genetic marker. So just let the physician know that.
All right, Dr. Lindsey, thank you so much for being with us. We appreciate it very much.
Great.
Coming up next on CBS 8 and ABC Montgomery, Ryan's back with a look at your full forecast. Don't miss it.